Hi, I'm Dr. Shah. As an orthodontist, I got braces on, so a lot of times people ask, what is it like to get braces? Is it okay for adults to get braces or not? So I thought I would say a few things about what to expect as an adult. I had them when I was younger. I got them again as an adult. I don't remember it bothering me at all when I was a kid, and it bothered me 10 times as much as I remembered it bothering me as a child. A couple of questions that we get often is, what's the worst part? For me, the hardest part was I had to put little bite ramps behind my front teeth, so some patients will get these. Sometimes we'll put them on molars, but what they do is when you bite down, it doesn't let your bite go back to what you're normally used to, and it prevents you from biting your own lower braces off. It'll make sense if you get these, but these bite ramps will not let you chew your food the way that you're used to. So chewing was really hard in the beginning. That took a little while to get used to. Besides that, poking wires every once in a while on the back. As my teeth start to move, the wire will shift out towards the back, so a poking wire was a common issue. On some days, pain will come on certain areas, so it'll bother you on the upper right, for example, and then 4 days later it doesn't hurt, and all of a sudden a tooth on the upper left will bother you. So that's a common thing that adults will say. Is it okay that it's hurting me over here once and it's hurting me over there another time? And yes, it's okay. Sores on your lips and cheeks and stuff is a common issue. For the most part, all the sores and cuts and stuff bothered me they were off and on for the first 3 to 4 months. But after the first 4 months, they really didn't bother me. I had a couple weeks in there. I've had them on for almost a little over a year and a half. There were about 2-3 months in there where I needed to get them off and I couldn't stand it, and luckily I wasn't in the office, so I wasn't able to get them on or off. But now that I look back, I'm almost done. In my opinion, it wasn't too bad. As far as most of our adult patients, I would say 60-70% of them are pretty good with them within the first month or two. And there's probably 20-30% of them that struggle with. Some of them are 6 to 12 months, and some of them, like my sister was one where she had them on for 2 years, and for the entire 2 years she had cuts and bruises and soreness, and she complained the entire time. So it is patient to patient dependent. But overall, I didn't think it was as bad as I thought it was going to be. But definitely harder for adults than it is for kids. I think we just become babies as we get older. That's about it in a nutshell.